That's perfect.
Thank you very much.
So we've heard so much about cancer as being one of the leading killers in Malawi or maybe probably across the world. What is breast cancer?
Maybe let's start with cancers if people maybe don't understand what a cancer is. Basically, if people understand that our bodies are made of little cells, little parts, and they're cells, and what would happen with a cancer, normally our body, the same way like, your cells will regenerate, they continue to make new cells, the same way your skin feels fresh because you're getting new cells and it's organized, there's nothing abnormal that's happening there. With cancers, something goes wrong with that sort of continuous process of renewing the cells, and so you get the cells growing out of control. That is what a cancer is, and it can happen in any body part. And so when we're refining to breast cancer, it means the cells that have started to grow abnormally are starting from the breast.
Okay.
Yes, and so that's what a breast cancer is. Your cells start to grow abnormally, and then they cause what is known as a tumor, which then sometimes can spread. And sometimes you will get different. Cancer in its essence is that growth, but then it's also the ability that growth can grow to other parts of the body. So I think you're also able to know that sometimes we'll say she had breast cancer, she's had something in her lungs or maybe somewhere on her arm, because cancers have the ability to spread what is known as metastasis. And so that's also one of the key things about a cancer is not only the abnormal growth, but also its capacity to grow, to spread to other parts. Yeah, so most people need to understand that not every lump or growth is a cancer. Some of them are just abnormal growths and they're called benign. Whereas a cancer, it's the ability for that to spread to other parts of the body.
What causes this abnormal growth?
So there are different things, and again, maybe just to encompass that, because cancer can happen in any body part, then every body part has different reasons why they will have cancer. For breasts, often it's related to our genetics. So most people, I think you also know that if you have a family history of breast cancer, you're more likely. So if you've had a mother, especially a mother or a sister, direct family correlation with breast cancer, you are highly likely to get breast cancer, and that also is related to the genetics of your body. But sometimes there are other factors that play a role. So specific to breast cancer, it's usually genetic, but also other factors play a role. And we know that Black women, for example, are more likely to get breast cancer than other races. So there's other things that are also playing a role in that, and how people can get breast cancer.
About Black women, I've heard it before, but I've been meaning to actually get a proper explanation to that. Why is that?
Again, I think it's to do potentially with our genetics, and also the risk factors for breast cancer. Like I said, there's multiple factors. So even the genetics that play in terms of race might predispose you to being to any type of cancer, including breast cancer, but also some of the environmental factors and what we're exposed to as Black women. So especially, for example, in the US setting where these studies have been done, I think they're also looking at contrasting about the type of cancers that they get. Even though, for example, the cancer that Black women get is usually more aggressive. So by the time you're identifying that type of cancer, it's usually at a very advanced stage, which is also the same thing that we're finding in Malawi, is that by the time women are presenting, we're diagnosing it's a breast cancer, but it's at a late stage. So it's harder to save them and so forth. So that also plays a role in terms of the type of cancer that Black women get, is something that influences the mortality, how many women are dying. Yeah.
Let's talk about the signs that somebody can possibly present with to say, possibly maybe this could be breast cancer.
Sure. The most common thing that we advise women to look out for is any changes in the breast. And ideally, I think we will get into that as well, is that we know your breasts have lumps anyway. And they do change anyway, especially with your period or your menses. They will change. They will they'll become a bit tender or whatnot. So generally, though, if you're used to examining your breasts on a common, sort of regularly, you'll be able to find that this feels strange, it's something abnormal. So either you'll find a lump, or you'll find that the skin is changing color, or that the skin is getting pulled back, or that you're feeling pain or a discharge. So there's a couple of different types of symptoms that you look for, but it's mainly changes in the breast. Okay. So any change that you find in your breast that is not your norm. So like we said, if you know that when I'm having my periods, for example, my breasts get tender, they feel a bit, that's normal for you. But let's say you feel that 2 weeks after your period, and that's never happened, then you should wonder maybe that's something going on. If you feel something like your skin feels different, we often talk about, for example, it's a common thing that they love to explain. It feels like an orange peel. You know how the orange peel has those little yes. So that's not normal for a breast. So if you're seeing that anyway on your breast, then that should be something that you should ask to get checked out. Sometimes you actually see that it's getting pulled back. The skin is, because what the breast cancer does, this tumor is it starts to pull in, so you can actually pull the skin, so you'll feel like the skin is getting downwards, like it's being pulled back, and that can also happen to a nipple. We know that, for example, your nipples are different. If your nipples are always going backwards inwards, like inverted, that's normal for you. But if your nipples were normal outwards and then suddenly they're coming backwards, that's changed. So that's something. Yeah, so it's mainly these changes. It's either a lump, change in color, a change in sensation, or a discharge, or something like, for example, like I said, your nipples coming back. So anything that feels abnormal, you should be looking out for.
At what stage, because as ladies, there are different stages. Comes the adolescent stage, comes the childbearing stage, comes the menopause stage. At what stage are we exposed? At what stage is a risk factor that you can get breast cancer?
So in the Malawian population, I think we're seeing younger and younger ages. So I think we've seen quite prominent, I think we've even seen like a lot of campaigns for women who are being, sort of younger, around the 30s and so forth. So in general, globally, the data says that breast cancer risk goes up above 40 onwards. But we do see many people younger ages. So most of the time we're asking women from ages 25 up to start, even 20s, you just get used to your breast. I think that's something that we're trying to advocate for, is for women to just get used to understanding what their breast is like, because the earlier you pick it up, the better the chances of you to get management and diagnosis and things like that, as opposed to like I've said, a lot of women do present late because maybe they didn't notice, and it's not, it's not a blame thing. It's just that sometimes some of them are harder to find, especially like, for example, if you've got bigger breasts, maybe it's harder to find a small lump or a change of color. So it's something that we try and promote people to sort of get used to their breasts. But the age, it's more likely early 30s upwards, I think, in the Malawian setting. So in your 20s, just start getting used to doing that, so that by the time you're in the 30s, you're very used. If anything abnormal happens, you're very used to it. And then definitely more like, because screening is in 2 phases as well. There's screening where you're just doing your normal breast exam as yourself. But as you grow older, then women are also advised to go for actual clinical screening, right? So you're not just doing it by yourself. You can go to like there's things like mammograms, or like, for example, getting ultrasound depending on your age. Those things also help in terms of determining if there's something abnormal happening with your body.
In case you're just tuning in, this is Healthy Living, a program where we talk about non-communicable diseases. In this program, we are talking about breast cancer, and I'm joined by Dr. Bridget Malewedzi. This program comes your way courtesy of Mazin.
Life is an up and down journey where anything can happen at any time. But at any time, you have peace of mind with Mazin. Mazin offers all-inclusive affordable medical aid cover in various packages of schemes in line with your budget, with a promise to take care of you and your family in that time of dire need. From giving you access to medical services at hospitals locally and abroad, emergency evacuation, dentist, and optical care, all the way to funeral benefits, Mazin is there holding your hand, keeping you covered. For details of the medical scheme you need, call 01-820-298, 01-820-543, 0888-707-100, fax 01-820-217. Email infodesk@mazim.mw or visit www.mazim.mw. Mazim, your ultimate healthcare solution.
You talked about self-examining. Some people actually just hear about it. I also just hear about it. Yeah. But if you could just maybe explain how exactly one is supposed to do it, because one could be saying, I'm self-examining myself, when they're doing it the wrong way.
Yeah. And actually, it's actually a process. I did a video on this because I think a lot of people were interested. So it's not just sort of just touching. You start, it's ideally you need a mirror. You need to, so the best place, as we started, I explained that your periods affect your breasts anyway. Yeah. So ideally you should be doing your breast self-exam like 10-14 days after your period, so that's the baseline, your periods or your hormones are not really affecting your breasts. So this is so every time you have your period, wait a week or two and then do your breast exam. So every month you should be doing it. So that's something else to take note of. It's meant to be something that you regularly do every month. Okay. So you're doing this every month, and now the day has come. What are you meant to be doing? You're meant to ideally be in a private room, obviously, because you're meant to strip. You're meant to take off your top so that you can see your breast in full. Ideally, also get a mirror, because the first part of the examination is actually just looking. Remember what we were describing, that you might see a color change and something like that. So some of the changes are not lumps. They're actually, like we said, a color change or your skin looking like it's pokey. So you won't be able to feel that. You will see it. So ideally what you're meant to do is to get a good size mirror. So this is an advocacy for you want to get a good mirror at home, if you want to advocate for one, that I need the mirror for my examination. And the mirror, once you're in the mirror, take off your all your top, so that you're naked in front of this mirror. You start by sort of hands down, you're standing in front of the mirror, and then you will look. So you're looking at your breast, trying to see. So you're looking in the mirror and staring. So if
so you're looking at yourself.
Yes. So you're in the mirror. If this is the case, you're in the mirror. You look first, your hands down. So you're just looking at your breast. Just look if there's anything abnormal that you're seeing. Comparing the breasts. Not everybody's breasts are exactly the same. We know that. So one breast might have already been bigger. That's something. But you're looking for. And again, this is why we're advocating for doing this regularly. Because if you do this regularly, you'll pick it up quickly.
Yeah, you know this is me.
This is not me. This has changed. So first you look like this. Then you do this. So you're sort of like, it's that pose that we like to do when we're young. That should be easy. The reason you do this is because, again, you're doing something to the muscles are tensing. So that thing I was saying, that sometimes the skin will start to get pulled. If you do this, that can also motivate that pulling. So you might see something different, and also might able to see below your breast. So again, for some of us have smaller breasts, but if you've got bigger breasts, you can even lift and try to see in the mirror, so you can see below, because those are some of the areas we see challenges. Is like, if it was at the top, it's easy to identify. If it's at the bottom, you might not see. So again, looking underneath the breast. So in this position, look that way, and then the last position, you do this. You're looking in the mirror. So you start with looking, and again, all the things, just checking, is there anything abnormal? Am I breath? Is there any color changes? Is there any discharge or anything else? And then you stop. And then the next thing is, either most people say you can do this in the shower. The shower is because the water's running, so it makes it a bit easier, soft. But you can also do this in your bed. You can lie down and examine yourself. You'd have a process when you're examining yourself. Don't just you have to have a routine. Again, you can either start from here, go down, do this, or you start here, do this. Just make it's meant to be in order, right? So that you don't miss. The thing is, because most of us would just do this, and then it's just, no, that's not, you might miss it. Especially if you've got a bigger breast, you need to have a very organized way so that you can go across your breast, you're moving, and you keep your palm flat. So you're pressing down like this. So it's not because that's not how you're meant to do. So this is how, even as a professional, you're meant to examine. So this, keep your palm flat, use your 4 fingers, and just press. You can practice, so we see you you're practicing, and then you do this Yeah, so you're doing that and just trying to feel for this. So this is more of the feeling for lumps part, yeah. So you're doing that, and then if there's anything abnormal, then you might be able to feel that's strange. That's not my normal, and then you feel on the center. Then you do the same for the other side as well. Yeah, and that's at least you'll be able to figure out. Do I feel something abnormal? If you do, then obviously that's something to follow up with someone at medical. And then the last part, like we said, sometimes you will find discharge, but the discharge might not be coming out normally. So for those who are not breastfeeding, obviously, you can squeeze your nipple and then you see if there's any discharge or anything abnormal. But also, as you feel, apart from the lumps, you can also be feeling for like pain or anything. Like if your skin feels, again, because that orange peel skin thing that we were saying, you will see it because it looks pokey, but it also feels just a bit, so you feel like a patch of your skin feels slightly different from the way that your the rest of the bread. So that's something that you can do.
All right.
That's a long process.
Thank you so much for that. I'm your first candidate to practice that.
Yeah, so it's just as a reminder, look, then feel, and then you can squeeze, and then that hopefully will every month in between your periods.
Okay.
Yeah.
Now the issue of screening. There's so much advocacy going on about screening. How is screening done? Is it the same thing that we have done?
So there's different levels of screening. So the first level is self, right? Which is what we're practicing and showing people that they can do at home. The next level then is at the health professional. So again, the screening will either take on the role of as I mentioned, either it's an ultrasound, depending if you're younger, because when you're younger, your breast is easier to use an ultrasound to see. And then as you grow older, about 40 and so forth, then you need mammograms because the ultrasound is not, they can't see using the ultrasound, they might pick up wrong things, so then they use a mammogram. So those are the screening measures when you go to like an actual, like a clinic to try and do that. And it's something that we advocate for. You know, as you're younger, maybe once every 2-3 years. As you're older, I think then it's more regular because you're more at risk. And I think the challenge in the Malawian setting is these are not widely available, not common. So that's why we promote a lot of this self-breast exam with the thought that if you find anything, then you can go and try. Yeah.
You talked about a bit of duration as you're answering this. I know for cervical cancer, some give it 3 years, some give it 5 years, and if you're HIV positive, the frequency is a bit less. Yes. For breast cancer, is it the same or?
I think that one of the things that people need to realize is also their risk factors. If you're a bit older, you even the same way that the cervical cancer program has sort of decided to, if you're young and then it's 5 years. If you're a bit at certain ages, then it becomes 3 years. If you're HIV positive, you have to reduce that. If for example you have a sister who has breast cancer, you should be screening more often because you're at that high risk. If you've got a mother, a sister, so those are the kind of things that you'll be looking at. And I think, like we said, the self-breast exam is something you should just be doing regularly. It should be part of your routine. And therefore, then, if you have any real risk factors, family that has breast cancer or anything else, then you should be trying to think of like more regular, once a year or so forth, just to make sure, because it is, as I said, in our situation, we're finding women come late, and also sometimes the type of cancer that they have is more aggressive. So not like they're different forms of cancers, breast cancer as well, and so that also influences like your sort of prognosis in terms of how well you can survive and so forth. But ideally, what we're promoting is women doing the self-breast exam, and if anything abnormal come, because I think we don't have very good, I would say, screening services that should come every month and year, so that's the kind of thing that you do your self-breast exam, anything abnormal, then you come. But for those with high risk, I think they should be really trying to get a regular, like at least annually even. I think you can try and do that.
One of the points that's accompanied with the advocacy for screening is early detection saves lives. Walk me through the process where you do your screening, probably there's a detection that maybe you could have some cancerous cells. To what end? What is treatment that is given? There's mention of chemotherapy, radiotherapy?
Because there's different forms of cancers, it just depends. For any cancer, what you look at is what type of cancer is this? How advanced is it? So they're staged, right? Usually stage 1 to 4. That's 4 being the most advanced. So you also look at the staging. How early is it that we did? So the early detection saves lives, because if you find it early, the earliness is that it's just confined to your breast, for example. So, for example, removal of the breast might just be all that you need. Most of the times it's not just that, because you would remove the breast, and sometimes depending on, again, then they would add like either chemotherapy or radiotherapy, depending on what that is. So most of the time when you, let's say we did this exam and you found an abnormal lump, you go for a further sort of examination in a public setting or at the hospital, and then they would be able to determine stage, type of cancer. They would do a biopsy. The biopsy, they take a sample, then they figure out what type of cancer it is, if it's a cancer at all as well, and then from there, then they would determine whether you would need surgery, because usually you would want to remove the tumor, because otherwise it still can continue to grow. So either they'll remove, most of the time they just remove the breast on its own, depending on the type of cancer. Sometimes they will remove both breasts, and then depending on how far advanced it was, they might do other things like removing tissue here and so forth, and then you have treatment. So there's quite a range of things that are done for somebody who has been diagnosed with breast cancer. Now that you did your screening and they've confirmed, there's all these stages that you go to the clinician or the facility, they have to confirm it's breast cancer. Like we said, some lumps are just lumps. They're not, they just, an abnormal growth, but it's not something serious. And sometimes, it's not even a cancer, actually, it's something else. So that's something that first stage that happens. And the next stage is then treatment, and the treatment options range from removal of the breast and the tumor versus going to the extent of chemotherapy and other factors.
As we conclude, issue of lifestyle, be it the food that we eat, be it the issues of exercise in general, what would you say?
I think generally there's advocacy for exercise as being good for reduction of various cancers, because they do happen. There isn't like specific linkage of like this food versus breast cancer. I think it's very much genetically ingrained, and there might be some environmental factors. But I think, like we said, living a healthy life helps you, even combat, if, for example, you've got breast cancer, you would be able to, your immunity and so forth is helpful. So those are things that you'd be looking at. But in general, I think the main advocacy we have is for women to get into the lifestyle of understanding their breasts, understanding themselves, and then really, if anything abnormal, not to be scared, to be frightened, that there are measures and things that are available for people to get life-saving treatment. So that's something that people should be looking forward to. Great.
Thank you so much.
Thank you for having me.
That's what we had in this program, where we were talking about breast cancer. I was joined by Dr. Bridget Malewezi, who is a public health specialist. My name is Sarah Chilora. Remember, this program comes your way courtesy of MAZIM.
You have all your MAZIM information in one place. With the MAZIM mobile app, all MAZIM members register on the MAZIM mobile app. Download the app from Apple Store or Google Play Store. Install and open. Click register to register. Enter your membership number. The default membership number has 9 digits. If you don't succeed, try 11 digits. Choose your name, password, and OTP destination. Remember, when adding your mobile number, 265, not plus 265. You can also register with your email address easily and keep updated with your MAZIM account right in the palm of your hand. For more information, email infodesk@mazim.mw or visit www.mazim.mw.